Hi, this is Colleen Parsons again with the rest of your head, face, and neck assessment. Part 3. We're going to be looking at children for a minute. It is very important to include a measurement of the skull when you are doing an assessment on a child, especially an infant and a toddler. We're going to do that because we want to see how they're actually growing. That tells you quite a bit about their nutritional state and if they are progressing the way we hope they're progressing. When we're looking at children, we are, just like with adults, symmetry is one of the most important things we're looking at. So we are watching how they cry or smile, both sides of their face, are they using them equally? And we are looking particularly at some of their glands, especially the parotid gland below the angle of the jaw. So the physical assessment of the child continues with watching how they move their head and neck. Do they have neck strength? Every once in a while, we will be working with a child and find they can't lift their head up when they really should be able to lift their head up. Or they don't have full movement, range of motion with their head or neck. We will palpate, but you need to be very careful about palpating for anything other than just abnormal findings. So you want to do this very gently because, of course, you aren't totally clear on what you're doing. So if you have a chance to palpate a child's head, don't do it like you would adults with a firm touch. It's very soft and probably not your fingers, but more the pads of your fingers. I wouldn't recommend that you do any sort of percussion on a child. And we begin looking for bruits during auscultation, or using auscultation when they start to age a bit. Transillumination is an interesting thing in children, but we're really not going to do that. That is more of a high-level skill. Inspection of the pregnant female. Do you like how I was able to find all of these Mr. Potato Head things for you? Physical examination of the pregnant female. There are a lot of things that change with pregnancy, and if the thyroid gland is palpable during pregnancy, that's a normal thing. Again, you want to come from the posterior angle for approach for assessment. And looking at sometimes there's hyperpigmentation or a discoloring of the skin, cheeks, and forehead that does fade away after delivery. The pregnant woman won't believe you, but it does. And then inspection of the aging adult. Hopefully I don't have flies zooming around me. We are looking at the temporal arteries. Are they prominent? Has the patient lost so much weight in their face that you can actually see their skull? In some aging adults, a mild rhythmic tremor of the head may be normal. Senile tremors are benign and usually include head nodding or tongue protrusion. Those are things that we think the aging adults should be able to control. Aging adults have a tendency to do more mouth breathing for whatever reason, and their chin will sort of slack open, even when, as a younger person, they would never be seen that way. There may be a loss of teeth, which makes the mouth look kind of odd and sometimes asymmetrical. The neck changes as we age, and kyphosis can be an issue, that curvature of the neck that gives people sort of a humpback look, but you want to see if they have full range of motion. And with older people, you've got to be careful, because if you do this, sometimes there's an inner ear issue, and that could make them very dizzy. So be careful how you're doing that. Sometimes glands, when they're swollen or prolapsed, especially down here, they can be taken for tumors. So don't jump to any conclusions. You as a nurse are just gathering data. So here is a subjective, objective, and the assessment. Don't forget that when you are delivering, after you have done your assessment, your skills assessment on the head, neck, and face, you're going to be delivering an ISBAR report to me. Pediatric facial abnormalities. We'll go through some of those in class so that you can ask questions. And here's your checklist. I would really highly recommend that you review this checklist. And that's it. Thank you very much.